volunteer at the Alabama Poverty Project and directed development and communications at Urban Ministry in Birmingham. She lives with her husband, Zach, in Montgomery. Ladies and gentlemen, I give you Miss Robyn Hayden.
Thank you so much, Joe. Thank you, Gary. Thank you, Robbie, and everyone who invited me to speak tonight as your first webinar speaker. I have to say, I've been working from home now for going on 9 weeks, over 9 weeks, and been on a lot of Zoom meetings, but being able to do a Zoom conversation that's a little bit more intimate with people I don't know, it feels like I'm going out into the world and traveling. So it's nice, and I'm excited to chat with y'all. So I'm hoping Robbie can pull up my PowerPoint presentation. I can't figure out how to make it work, so maybe Robbie can do screen sharing with y'all in a minute. I'm not usually a big PowerPoint person, but I will say I wanted to help structure my talk tonight to move through the important issues that I want to cover. But at any time, I will say, if y'all want to weigh in with a question, it won't throw me off at all if you have an urgent question. I realize we have time later in the agenda for that as well. So I thought about what I really needed to talk about tonight. It's obviously who arises, what we do, why we do it. But in this moment and this time, it's about state policy, racial equity, and our response to the COVID-19 pandemic. So if you can move to the next slide, Joe. I'm sorry, Robbie. Before I get into all that, here's what I want to cover. I want to talk about who I am and how I got into this work, who arises and how we work, what we think is next, and most importantly, how you can get involved if you want to join some of our campaigns. So I already had a great intro. As y'all heard, I am an Alabama native. I've worked at several nonprofits. I have raised money for direct service organizations and ministries. I have been an AmeriCorps volunteer. I've been a community organizer. I grew up in Shelby County, which is the wealthiest county in the state. I grew up in a Southern Baptist evangelical family. And growing up, I always felt like the way to help people and the way to make a difference and to live out my Christian faith would be to go overseas and become a missionary. I know many other people that I grew up with share that same story. I have family who are pastors, ministers, missionaries. My mom is a social worker. My dad's a small business accountant. But they raised me with a public service ethic. We should make the world a better place. This is what you do as a Christian. You are called to love people and really to make the kingdom of God appear here on earth. And that's how I was taught to live out my faith in an ideal world. When I got older, I sort of translated that missionary zeal into the idea of going into international development. So when I went to Vanderbilt, I studied anthropology, which my dad was just thrilled about that, and worked overseas, did some research in Latin America. So I got to spend time living in Guatemala and Peru, learning new languages, experiencing what it's like to be an outsider. And that always gives one perspective on one's own culture and identity, right? So around probably my sophomore or junior year of college, when the Great Recession hit and the US economy was in a downward spiral, I met Dr. Wayne Flint. And Dr. Wayne Flint is an eminent Southern Baptist historian, author, intellectual. He's a Sunday school teacher. I feel like he's like the Jimmy Carter of Alabama. And I went to this event called the New Baptist Covenant. So as I said, I grew up Southern Baptist. And one of the things that had really started to bother me as I grew up was how segregated our church was, and how people would go to the mission field in Latin America but would not identify the huge needs within our own backyards. And the New Baptist Covenant was a racial reconciliation effort of the Cooperative Baptist Fellowship, which I had become a member of, and the Missionary Baptist Church in Alabama. And it was a big event that they launched at 16th Street Baptist Church. And long story short, I had this like come to Jesus moment where Dr. Flint said, you know, if you really want to find the mission field, look to our own state. Look to the huge historic inequities of our racist state constitution, of these policies and practices that have been instituted into law that have really disenfranchised Alabamians from being able to solve our own problems and to identify these huge divisions that we've created and to really address them. I say it was a come to Jesus moment. It was really eye-opening for me because growing up in Alabama, I think we didn't always have the best education on our own history, on our own civics, and our own political system. So I had been living in Guatemala, and I was studying Guatemalan politics and history and organizing. And people in Guatemala actually had very well organized local democratic control of their own communities. And I'm hearing Dr. Flint talk about Alabama and how we are disenfranchised from controlling our own communities. And it really doesn't matter if you're politically more liberal or more conservative. The one thing that I think everyone around the state who I've talked to agrees is that people should make decisions to govern themselves. That's a cornerstone of our principles. People with the most proximity to problems should be able to solve them. And that's been an understanding in ministry and in international development as well. And I had this revelation that there's really no reason for me to go help build infrastructure or community development in a foreign country. It wasn't what I really was meant to do. So when I graduated from college, I joined AmeriCorps. I went to work for the Alabama Poverty Project, which is now called Alabama Possible. And that is an organization that focuses on things like college access, service learning. But one of the most exciting things about that organization was I got to travel all around the state and meet with groups who were doing direct service and poverty alleviation work, and just convene conversations about, hey, what's missing? What are the missing links? And as y'all know, anywhere you look in this state, whether you're on a very micro level or you're zooming way out, there's a lot of gaps. And it really helped me build a whole career working in nonprofits and poverty alleviation and advocacy. And so I've, you know, as Joe said in the intro, I have worked at a lot of nonprofits. I didn't realize that community organizing was actually a real job or a real opportunity until I connected with Alabama Arise. So I want to go to the next slide and talk more about Arise, who we are and how we work. So y'all already heard this mission statement, this description of who we are. Alabama Arise is statewide, nonprofit, nonpartisan. We are congregations, organizations, and individuals. Our number one goal is to alleviate poverty by addressing state policies. So there are a lot of advocacy orgs that focus on federal policy, and there are groups that organize at very local levels. And we feel like because of how much power has been concentrated in Montgomery, we have to be very present at the Alabama legislature. So that's where we invest most of our time and energy. And you can go to the next slide. We were founded 30 years ago, more than 30 years ago. This is our vision for the state. And we feel that more than anything, if we are not following through on this vision, if we don't keep this vision in mind, it can get really, really easy to be bogged down in the weeds. But the ultimate vision is that all people have resources and opportunities to reach their full potential. Every generation is ensured a secure and healthy future. Our government is responsive, inclusive, and justice serving, and people are engaged in making policy. And then all people live with concern for the common good and respect for the humanity of every person. So, you know, we do this through policy analysis. We do this through advocacy and community organizing. We do this through lobbying at the Alabama legislature. And you can go to the next slide. And if you want to sign up for email updates, I'll say this again later, please visit our website, allarise.org, to learn more about who we are, how we work, and access a lot of the policy analysis and advocacy resources we've developed over the years. Next slide, please. And I believe it's always better to see real people. So this is our staff. And I've actually got these two people who are added who we've just hired right before the pandemic hit. But our staff includes 4 community organizers, 4 policy analysts, a lobbyist, a communications team, a story collector. But our goal is to really make sure we're connecting with our member groups throughout the state, that our members are informing our response to state policy. And so it's a feedback loop of, we tell them what's happening, they tell us what needs to be happening or what would help them do their work. We try to get out credible, timely, relevant, easily digestible information for people to really take meaningful action for the issues that they care about. Next slide, please. And the coolest thing about Arise is that we are member-based. So we invite church groups, nonprofits, civic groups, grassroots groups to join us. We're up to 156 member groups. 80 of those are faith-based, our churches. A lot of those are nonprofits, direct service, civic groups. And then there's a fair amount of just loose organizations, that are self-contained, grassroots, student groups, local chapters who form to address local issues or specific concerns. And I really wanted to celebrate the number of Episcopal church members we have from Birmingham, Seal, Decatur, Florence, and the diocese is a member as well, and Mobile, I can't forget Mobile, Tuscaloosa. So really all over. We're able to connect with people who are directly serving through charity, people who are directly serving in nonprofit capacities. Some of our best engaged members are teachers, social workers, Sunday school leaders, but they're really the glue who hold together the community and who can help us connect the dots between state policy and what's happening in their own backyard. Next slide. So I'm really excited that one of the first issues that our board and staff agreed to work on after I became the director in 2018 was examining our commitment to racial equity and inclusion. I'm really grateful that Gary Moore serves on our board of directors, and he has been really helpful in this process. I'm really grateful that Reverend Carolyn Foster is our board secretary. She's been so helpful. We have always talked about racism and its role in building these barriers to people getting out of poverty, its role in really keeping Black people in poverty and Latino people in poverty in our state. But we had not really done a systematic analysis of how do we talk about that and address that now? How do we make sure that our policy team knows how to look for that in the data that we analyze and share? How does our lobbyists talk to lawmakers about that? How do our organizers connect with community members about that? It was really eye-opening for me as an organizer with Arise. I was hired originally in 2013 to go out and talk to folks around the state about the Affordable Care Act. And, I was surprised by two things. First, I was surprised by the number of people who really liked learning about the Affordable Care Act and found it to be a helpful policy. I would go to rooms of people who I was told ahead of time would be pretty hostile or not very welcoming. And what I found is that when we talked about real issues like healthcare, everybody listened and had something empathetic and knowledgeable to say about that because it was an issue that truly touched everybody. But I was also surprised by how segregated a lot of communities still are. And I shouldn't be, because I grew up in the Birmingham area. Birmingham is the most segregated city in the South. I met my husband because he was researching racial segregation and social movements in Birmingham, and how the segregation of our nonprofits and our community organizations led to white-led groups getting a lot of funding, black-led groups getting left out, but being used to raise money and so on. But it still was really shocking to go out into the field and find it was very hard to bring together multiracial groups of people to talk about real issues and to connect the dots on different sides of town. So Arise has some work to do here. And we developed this statement about what our commitment to racial equity and inclusion looks like, what we understand it to mean. I will say we have still, as a staff, are trying to become better informed every day, become more comfortable and open about discussing race, become more knowledgeable about the ways race plays into political and policy discussions, and to just be brave in confronting that. So we said working towards racial equity means understanding and acknowledging historical and ongoing racial inequities and challenging them consistently. We see racial equity as both a structural outcome and an intentional process within all areas of our work, including policy analysis, organizing, and advocacy. So I like that we included this about, it's not just something that you achieve. It's not something that our state is going to achieve overnight, or that our organization will somehow accomplish. It's a process for us to engage in and understand as a continual striving. But the outcome we would hope to see is that your racial identity does not statistically predict your quality of life. And our state has a long way to go there. As a process, we must take deliberate steps to ensure that communities and people of color are meaningfully involved in the creation and implementation of policies that influence their lives. I will say, I think we've been getting a lot of tools and support about how to really hold ourselves accountable to this. One of the best features of Arise is that we were founded by several women who were pretty smart about racial equity and inclusion over 30 years ago. And they insisted on a process in which Arise's membership would select our focus of work. And they insisted that at least half of our board would represent low-income people. And that has meant that over the years, Arise has worked on a broad array of issues that affect many different racial and ethnic groups, that we have intentionally sought more feedback from communities that are directly impacted because we're forced to in our bylaws. But I think we could still be more nuanced and skillful in how we do that. So I want to move to the next slide. But getting on the topic of how communities weigh in on, and how people from around the state weigh in on our agenda, we have a process in which we ask our partners to propose new issues every year. And so those issues can rotate. We have a membership meeting in September. Our members vote, and if they decide they'd want to work on something new, sometimes we'll move on to a new issue. But at the cornerstone of our work, we always maintain a focus on some core state tax and budget issues. So I want to talk about the core issues we work on, and then I'll get into how the other issues rotate and what those are right now. So at the one core issue we've worked on since our founding is, why is our state so broke? And why is it that certain communities get the lion's share of resources? Schools in predominantly wealthy and white communities are more well-resourced. Schools even in middle class and lower class white communities still have more resources than in Black and Latino or Indigenous communities. And a lot of that goes back to structural issues with how our state raises money and how our state apportions representation in the legislature and who is making decisions about how that money gets spent. So the number one thing we always pay attention to at the legislature when they go into session is what's in the budget and who is it benefiting. And that's a pretty big job. You know, right now the legislature is back in session after delaying it for about 6 weeks after spring break. They've decided they must go back in and pass budgets, and they've claimed that's all they're going to do. But we're really concerned about some other things that they're trying to sneak into the budgets. For example, so this is interesting. I was making this slide, and on this slide, I try to show all the pieces of state infrastructure that people don't necessarily think of immediately when they think about what our legislature is responsible for. But they're responsible for, you know, apportioning funding for schools, for first-class pre-K, and funding for childcare subsidies, for who gets a driver's license office in their county. Do hospitals have enough money to operate? Can you get to a dialysis center if you're on Medicaid, or are you going to lose your dialysis coverage? So I used to have a slide here that was a road with a bunch of potholes in it. And the amazing thing that happened last year is that our legislature realized we can't keep failing to invest in our infrastructure like roads and bridges. And they passed a gas tax to fix those roads and bridges, which, you know, I think a gas tax is not ideal. It's certainly regressive. But at the same time, it's one of the only ways we have to bring in more funding to build up our infrastructure. So I looked up yesterday, and there is now a bill to take that gas tax money and give it out as small business subsidies in response to COVID. So these are the kind of issues that when we're advocating for people in poverty, we're really keeping a close eye on those kind of debates. You know, is it more, what are our values as a state? Because I think a budget is really a moral document. It shows what we truly care about. So we live in a state that, you know, I was raised with these evangelical values of we're pro-life, we take care of the least of these, we care about children. And yet when you look at how we're spending our money, it doesn't always align with those stated values. So I think keeping track of these budget spreadsheets and these budget debates is a core part of our work and will continue to be. If you'll move to the next slide, I'll get to what the flip side of that is, which is taxation. So I mentioned the systemic structural inequities that cause us to underfund our state budgets, and that gets back to our tax system. Our state constitution was written in 1901. It outlined several ways in which we're unable to raise revenue in the same way that other states are doing. So our property taxes are capped, and we have the lowest property tax rates in the nation by far. We have a flat income tax rate, pretty much. One of the biggest victories that Arise has won is basically protecting people below the poverty line from having to pay the same level of income taxes as millionaires pay. You know, when I was actually in high school, I got my first job. I made, I don't know, $5,000 a year. I had to pay the same income tax rate on that income as my parents did. And we got the standard deduction raised so that at least, you know, people who are very, very low income are not taxed at that same rate. But we still have a tremendously inequitable tax code because income taxes are low, property taxes are low, sales taxes are the only other way we have to make up the difference. Corporate taxes are also important. But when we're focusing on the impact of individuals, those are the big three that individuals are paying. So we worked for years to remove the sales tax on groceries, for example, which is just one way that we tax people's basic standard of living, and we tax people deeper into poverty. And if you'll go to the next slide, This is the slide that really highlights why this is regressive. You know, people making under $18,600 a year pay the highest percentage of their income in state and local taxes. Then people making under $32,000 a year pay almost that amount. But when you get into people who are more comfortable making over $85,000 a year, you may be paying half the tax rate of somebody in deep poverty. That's why our state is so broke. You can't get blood from a turnip. Is that an expression? You can't raise money from people who don't have it. And our inability to invest in programs and opportunities and people is perpetuating a cycle of poverty. So what Arise is doing about this, we've actually advanced a bill to remove the sales tax on groceries. And the way we would pay for it is to get rid of basically a tax loophole, a federal income tax deduction that predominantly benefits people in these top income brackets, the top 10 to 5%. So if you pay federal income taxes, you can deduct those from your state income taxes. And that's what makes this tax curve so upside down, because lower income people cannot take that deduction. If we get rid of that deduction, certain people would pay more in state income taxes. It's not going to be easy to do. It would involve a constitutional amendment, but everybody could remove the state sales tax on groceries. And we think it's a simple thing we need to do. It's politically popular. And we actually had a bill sponsored by Senator Andrew Jones from Gadsden, who's a Republican, that was moving through the Senate before COVID hit. So I'm very confident that we actually, we have a bunch of freshman lawmakers who came into the legislature last year who saw this gas tax increase and felt like, whoa, this is a little bit unequal. I want to be able to go back home to my district and tell people I did something for people who are struggling. And we feel like this is one way lawmakers could do that. And we think our community knows that this is what we need to do. There are other ways we can make our tax code more progressive. I won't get into it. We've published a whole handbook outlining what we would like to do and what we would propose. And some of those are broadly conservative with both conservative and Democratic and progressive lawmakers. There's some things about the way we tax corporations that, does disincentivizes small business. And we feel like that could be done better. The federal income tax deduction actually makes our corporate income taxes look higher than they really are, because corporations also take that federal income tax deduction. And so there's a lot that we could do to modernize our tax code and make it more fair. And we think it doesn't matter which party is in charge. We've gone through all kinds of leadership in the history of our state. We must continue to call on the people who are leaders to make this right. So I want to get into the next couple issues that are directly related to taxes and budgets and what our state can afford to do and what our commitments are to do. If you could move on. So one of our biggest priorities right now is to expand Medicaid. And for years, this has been seen as a fairly politically fringe issue. I mentioned I came on board to Arise in 2013 as an organizer. And at the time when our state was given the option to opt in or out of it, Medicaid expansion, it seemed like it would never happen. We pushed really hard back then to pressure Governor Bentley. Now that Governor Ivey is in office, a lot has changed. And 36 states and the District of Columbia have all expanded Medicaid. Medicaid is a state and federal partnership that basically is a safety net program for low-income adults and children who otherwise would not have health insurance. So maybe, telling y'all stuff you already know, but the basics of it get into how the Affordable Care Act was passed. And when the Affordable Care Act was passed, it was written so that people making under 100% of the federal poverty level would be enrolled in Medicaid. And that was the way that healthcare was going to be affordable for everyone. People over the poverty line have the option to enroll in the marketplace and get subsidies that help make their insurance more affordable. But a lot of working people, a lot of caregivers, a lot of adults, you know, who just make our state go, the people who work as grocery store checkout clerks, custodians, you know, the people cleaning up at the hospital, they bartenders, restaurant servers, they are not making enough money to get on the marketplace, and they should be covered by Medicaid. So our state is really failing people. We think that over 700 people are dying a year because of their inability to access health care and preventative care. Medicaid expansion is a great investment that our state could make. And there's a huge amount of federal matching money that also makes it a really good deal for our state. So there are a lot of, you know, sorry, I just saw that question pop up. I'll let you look at it, Joe. There are a lot of reasons why we haven't expanded it, but we think increasingly our legislators from both parties are seeing that we cannot afford not to. And if you move to the next slide, I want to highlight some of the racial equity concerns we have about healthcare. So these are two of the most shocking things I've seen. We've been finalizing our Medicaid expansion report, which we're releasing within the next few weeks, to really hit home for lawmakers what Medicaid is, what it could be doing, and how it could be a huge help to us, especially in this period of crisis. But we have had ongoing healthcare crises in this state for years. And if you look at this chart on the left, you know, this is the maternal mortality rate for Alabama. So I don't know if you can read that the national average maternal mortality rate is right under 30% and Alabama's right under 35. So that doesn't seem like a big difference, but the biggest difference is between the Black maternal mortality rate and the white maternal mortality rate. Black mothers are dying at more than twice the rate of white mothers in this state. It's really shocking. It gets into a lot of deep inequities happening in our state, but a driver of that is the fact that Black folks are more than twice as likely to be uninsured because of working in low-wage jobs or falling through the cracks. You know, when you look at who's uninsured in our state, 49% of all uninsured people are Black Alabamians, and they make up 25% of our population. Similarly, a lot of rural folks don't have access to hospitals. And we know that what rural Alabama looks like is not the stereotype of, you know, we don't think that Black is urban and white is rural. But there are so many rural families in our state who are not accessing adequate maternal health care and postnatal health care. The infant mortality rate is also a reflection of this. So if you look at the second graph, the Black infant mortality rate is several points higher than the infant mortality rate for white and Hispanic children. I think if our state values life and values family, we must do what we can to support families. There are a lot of other people who need health care. It's not just an issue about childcare or moms, but I think this just really illustrates what we're failing to do when we fail to invest in our state's people. We're actually losing people. Okay, let's go to the next slide. So I'm going to run through the rest of our issues pretty quickly because I want to leave time for discussion or questions. But a key issue with taxes and budgets is what kind of safety net are we funding? So we're in the midst of one of the worst economic crisis that probably any of us will see in our lifetimes. It's the crisis in which you hope that the safety net is there for you. And I think a lot of us may assume that it will be. But our state is consistently trying to carve out and pull back some of the programs that were established in the War on Poverty and the great programs that helped us build the great society and the strong middle class that, you know, was a key part of our country for so long. So programs like Medicaid, SNAP, which is food stamps, TANF, which used to be known as welfare, WIC, which is women, infants and children, nutrition assistance, unemployment insurance. These are all programs that have been under attack year after year after year. And we have been sort of calling lawmakers to say, you really don't want to do this. You know, they've done things to undermine our ability to extend SNAP over longer periods of time, or to get rid of work requirements at a time when there's massive layoffs. So this is a huge focus for us right now. When you look at where our staff time is going, we are really drilling down hard on what are the barriers to people accessing these programs, which have been designed for times like this. And how do we strengthen them? How do we ensure that they're not the first thing on the chopping block at a time when they should be the top priority to help us survive this crisis, and for families to come out stronger, or at least stable, to ride out this emergency. So let's move on to the next slide. So we're getting into the issues that our members vote on. And I mentioned this briefly. We have a rotating issue agenda. Every year, our members can select 5 priority pieces of legislation for us to address in the session. And it's a lot of fun to have member groups present proposals for what needs to be done and how we will push it through the legislature. So the top issue that got the most votes last year was about funding for public transportation. I don't think I need to explain this too much. Our state is one of the only states in the country that has no state funding for public transit. We actually passed a constitutional amendment back in the 50s, banning our state from using gas tax revenue for public transportation. That was in direct response to the bus systems becoming desegregated. So that's the history that a lot of people don't know or understand. They just see public transit as a crumbling system, when the reality is that our state could invest just another 5 or 10 million. We could bring in a lot more federal money to pay for transit that's necessary for rural communities, urban communities, senior citizens, disabled people, on and on and on. So we've established the Public Transportation Trust Fund. That's something I'm very proud that I was involved in coming up with that as a strategy with a group of transit folks and riders in Birmingham. And now we've just got to fund it. So we'd love your help if you care about public transportation. Lawmakers need to hear about it, because we've heard from conservative, liberal, doesn't matter, urban, rural. A lot of lawmakers know this is a big need. Mayors know it's a need. Businesses know it's a need. We've got to build pressure so that they can actually fund what we need. Let's move to the next one. Payday and title lending reform. This is an issue we've worked on for so long. I got really involved in this when I was organizing in Birmingham. And the basic thing is payday lenders are ripping off borrowers. They're charging exorbitant interest rates. Those interest rates were carved out in a law that was passed in the early 2000s. So it's not like this has always existed. They've been given a special exception to charge people much more for these short-term high interest loans. And a certain number of people are able to pay back the loan, but there's a significant percentage who get trapped in a cycle of debt and end up paying and paying and paying. This is a man's story I shared. He's actually from a report that Alabama Appleseed put out, and I know that y'all are going to be speaking with Carla from Appleseed next week. And they've been key partners of ours in addressing this. So I will just say we have a bill called 30 Days to Pay. It would essentially cut the interest rates on payday loans in half and give people twice as long to repay their loan. That bill died in committee really early on this legislative session. It's this year after year, it's a very similar situation that we're seeing. We've got to keep the pressure up on this because, again, I think this is a bipartisan issue. There are certain moneyed interests who are pressuring the committees, and it doesn't seem to matter whether what people's political affiliation is. There's a lot of money going to lawmakers to, protect this industry. And we simply think they could cut their interest rates significantly. They could still operate. We've seen other states do this. Borrowers still have access to credit. But we really need to protect people from being exploited when they're most vulnerable. And I'm grateful to the Episcopal Diocese for being a key supporter in this effort too. Next slide. All right, voting rights. To connect the dots, getting back to what I said earlier about people having control over their local community, and one of our key values being our government is transparent, inclusive, justice serving, and accountable to the people. A lot of folks are not able to access their votes. And right now, in particular, we're really concerned about what we're going to do going into this Republican runoff in June. How many people are going to be scared from voting just because of concerns about COVID-19? What are we going to do going into November? How many people are disenfranchised just from not having access to register, to restore their rights after coming home from jail or prison? There are a lot of different bills we're supporting. I believe this should be non-controversial as well. The more people who vote, the more people who participate, the better our elected officials will be. Next slide. Criminal justice debt and civil asset forfeiture reform. I want to acknowledge again, I'm using a slide and a story from an Alabama Appleseed report because they've done an excellent job of sharing stories of people who are personally impacted. So on court debts, on fines and fees, because our state underfunds our basic services so much, we're very reliant on fining people to pay for our courts. And one of the pieces of news that came out last week is that our courts are actually really scared about how they're going to function because they don't have these fees coming in. We simply need to fund our courts more adequately. In the meantime, we need to stop basically taxing people deeper into poverty through these fines and fees and throwing people into jail for their inability to pay. And I know I need to wrap this up so we can move on to Q&A, so I'm almost done. If you would move to the next slide. The last issue that our members voted for us to work on, and we've worked on for many, many years, is death penalty reform and repeal. So again, I will just say ARISE partners with a lot of groups like Alabama Appleseed, like the Equal Justice Initiative or Southern Poverty Law Center, who they have litigation strategies, they advise clients on death row. We partner with grassroots groups who volunteer in prisons. We think that the death penalty is just the most egregious and immoral example of how our criminal justice system penalizes people who are poor, how our justice system has disparate outcomes for people based on race. So we want to chip away at this legislatively, but we really feel like the death penalty needs to end. Alabama is the last state that allows you to sentence somebody to death on a non-unanimous jury verdict. The man who was executed last month, Nate, he was one of those who was a non-unanimous verdict. That's just got to stop. I think there's a Supreme Court verdict coming out, we hope, that will help Alabama end this. In the meantime, there are a lot of ways that this system is immoral, that it's not being instituted fairly. And, disproportionately, people in poverty and Black people are suffering because of this. So those are our top issues at the moment, but I will just say, because of the COVID-19 crisis, we really know that the legislature is not going to address much beyond the immediate crisis at the moment. We've worked on legislation on a lot of these issues that's just on hold. But all of these issues illustrate tremendous disparate impact to people based on which zip code they were born in, how much money their mom or dad makes, what race they are. And our state, when we present this data to lawmakers, a lot of them are shocked because I think sometimes they're not hearing from people directly impacted by these issues. So a big strategy we have on all of these issues is to educate voters, educate the public, and educate lawmakers by introducing them to human beings that they represent who are suffering because of these policies. Let me wrap this up. If you'll move to the next slide. I want to get to what you can do. I'd love for you to join Alabama Arise. We simply ask people to donate at whatever level they can. And because we're a membership organization, your membership gives you the right to vote on what we work on and to weigh in on it. So, you can join as an individual. You can also join as an organizational member if your church or civic group or nonprofit is interested. Connect with us on social media, subscribe to our email newsletter that's totally free. If you move to the next slide, I'd love for you to take action. So we have call alerts that we send out just to say, click here to make this one phone call today. We try to be very judicious in how we do that. We want you to call your legislator when they are being faced with a key vote on a key issue. And that's why we spend so much time and energy tracking what's happening and how we can best weigh in. Next slide. We have launched the Cover Alabama Coalition to broaden the conversation about Medicaid expansion. We don't want that to be only perceived as an Alabama Arise issue, as a we want to bring on the business community. We want to bring on sheriffs and mental health practitioners and all these other partners who we know support Medicaid expansion. So you can connect with that coalition. You may not be able to join Arise, but you can certainly join that coalition and sign on to say you support Medicaid expansion. Just visit coveralabama.org, click on Take Action, share your story, connect people who are suffering because of not having health insurance, and they can share their story there as well. I have one more slide, I think. Oh yeah, so this is the easiest thing you can do. If you haven't filled out your census, please do so right now. Just visit census.gov. Ask your friends or family if they've done it. The census is how the federal government apportions money to our state. So many of these projects and programs I've talked about rely on a significant amount of federal funding, and we miss out on millions of dollars a year because people across the political and ideological spectrum, across the income spectrum, are not participating, and we're not getting accurate numbers. So I just think it's a really easy way that you can be counted and ensure that your community counts. So I think that's all I have to share. If you want to move to the last slide, it's got my contact information. But I'd love to just have a conversation and answer any questions y'all have. Thank you.
Okay, thank you, Robyn, for sharing those insightful comments on the dynamics of governmental policies which continue to keep people in poverty and exacerbate their economic conditions. Let's see, our first question comes in. The poor among us pay a lot more by percent for sales tax, it seems. Everybody buys groceries. Poor people pay more by percent for groceries, and so more by percent for sales taxes. What are some comments you hear from opponents of the idea of not imposing sales taxes on groceries?
That's a great question. I've learned since I've been lobbying in Montgomery that the first question every lawmaker asks you if you want them to support something is they say, who opposes this and why? Because they want to know who's going to be bugging them. So the people who oppose this are mostly fiscally conservative, people who don't want to have to raise taxes. So the reality is that we rely on grocery taxes to fund education, as we rely so much on other sales taxes. And grocery taxes bring in almost $500 million a year in funding for the Education Trust Fund. So if we cut that revenue, we're going to have to replace it somehow. We've actually, the education budget has been doing fairly well relative to how it has been for the past decade. That's still not saying very much. We only just got to the point where our education budget is funded at the level it was before the 2008 recession. When you adjust for inflation, that's not very impressive. We're underfunding education, and we're going to have to find a way to make up for that money if we cut that revenue. So The biggest complaints we hear are, well, we're not going to raise taxes. Nobody has any appetite for that. My constituents wouldn't vote for this because it is a constitutional amendment. And our response is always, well, why don't you let your constituents decide that? Let's let the people vote on it. After the gas tax passed, there was a lot of discussion about how the people won't stand for a tax increase, but that didn't stop them from actually raising a tax. So I think the fact that we had a Republican sponsor this year, and we actually had other Republicans talking to us about other versions of the bill that would maybe go even further, is a good sign. I think we should feel encouraged about that and think that maybe the discussion is changing.
Okay, very good. Our next question is, how much do you think the COVID crisis will affect legislatures in their understanding that the welfare of the state affects all of us?
Well, I will say I have heard a change in tone in listening to the legislative debates. And I don't always listen, but there's a lot of caution and concern when it hits home for a lot of lawmakers who actually are in high-risk groups because of their age or medical history. Their tone changes pretty quickly. And also hearing Governor Ivey talk about this, she just went through a healthcare crisis and survived cancer and was treated by some of the top doctors at UAB who are now saying, hey, we need to take care and be cautious. And I think that really does have an effect. I think one of the key principles of community organizing and persuading people is if you're not personally impacted, it's really hard to get you to care a lot. And my hope and my prayer is that lawmakers being faced with this crisis that can truly impact any of us will change their approach to funding for healthcare and supports for employment and all the other programs that we know are going to be necessary.
Okay, thank you. All right, the next question is, how can the people in Alabama not feel powerless to make a difference? Is it so bad that we just give up? I like what Arise is doing, but how do we get the community to get involved?
Yeah, I will say I definitely feel this sometimes. I went through a period where I worked in a pretty stressful job day in and day out. It was a direct service agency, and I would come home at the end of the night and just feel like I have no energy to try to do much about all of these other things that I care about, So there's the individual concern of how do I keep my spirits high and be hopeful that things will change? And then how do I reach out to others? I think there are probably a lot of other people on this call who have better answers than I am because they've been in the struggle for a long time. But for me, it's just connecting with the reasons why change has to come, connecting with other passionate people, being in a church community that cares or a small group that cares. I think if you're out there by yourself, it's very lonely. And the number one thing I found when I was an organizer, when I was going out to meet with people is a single person alone would often feel like they were the only one. As soon as they heard someone else stand up and say, I'm struggling, this has happened to me, I believe we need to change, and I feel this way, that one person speaking out can change the whole culture and tenor of a room or of a person's life. It's incredible what sharing your personal experience and your personal story can do. I think it's one of the most powerful tools we have. So whatever is calling you to care and to be involved, it may not be the most life-shattering personal story, but when you share that, I think that's how you change and that's how you connect with others. And that's been my belief, that there are a lot more people out there who want things to change. We have to get over some of our social fear of speaking out or of being vulnerable about the ways we've suffered or the ways that we would like to see things change, and to do that in a way that invites people in. So That's all I've got. I mean, if you feel really discouraged, sometimes it's good to take a little break and connect with, you know, the things you care about. But it helps you to come back to the struggle for social justice, a little bit refreshed.
Okay, thank you. We have time for one last question, and it's been a good night, and thank you. If you were queen for the day and anything was possible, what would life in Alabama look like?
I just saw Demetrius say, glad to be here tonight. I'm glad to be here too. I think Alabama would look like a place where nobody's afraid. Nobody's afraid to know where their next meal will come from, to know how they're going to pay rent. No one's afraid to be in their house. No one's unsafe in their community. And, I think it's easy to envision a world like that. It's a lot harder to wave a magic wand and make it happen. But there's a lot of policies we could institute to make that reality a lot closer.
Great. Well, thank you, Robyn, for agreeing to speak with us tonight on these very important and timely issues. And we also thank you, the audience, for tuning in to our Zoom conference. And we would like you to know that we will be having additional speakers every other Wednesday for the next month or so. So be on the lookout for informational flyers. And as your screen shows, the website where additional information can be obtained about the speakers series and the commission's work. This screen will be up for 15 minutes. And be sure to visit our Facebook page to keep abreast on ongoing activities. Again, thank you and good night.
Thank y'all. It was an honor. Have a good night.